Since November, the number of people getting tested for COVID-19 has flattened across the country. It's been declining in several states as well. Dan Grossman looks at why it's still so important to get tested for COVID-19, even if you've already been vaccinated.
Much of what we know about COVID, who it's hurting, how it's hurting them, and how we try to stop it comes from a simple visit to get a nose swab.
So when we see testing decline, we always start to worry that we're beginning to miss infections and that people may be walking around with the virus and not knowing it.
A quick look at Johns Hopkins website will show that since November, our efforts to ramp up testing have slowed. It's that light orange bar, and in many states, they've gone down. That includes states that have seen some of COVID's worst outbreaks, like Arizona, Nevada, New York, and California.
There's some evidence that the amount of infection that's occurring in the U.S. is falling. So, that's good news, and that does mean likely that there are some fewer number of people who need to be tested.
Jennifer Nuzzo has a point. Like her, you might say, well, look at that blue line that shows the percentage of positive tests. It's declining even more rapidly than the number of tests. As a senior scholar at Johns Hopkins Center for Health Security, though, Nuzzo warns we cannot become complacent, because if we do, we will hurt our ability to analyze how the vaccine is curbing COVID's impact, especially with new emerging variants.
Testing remains critical for us to do surveillance, to know how many people are getting sick, and then to be able to look at a subset of those people who test positive and see if they in fact were sick with the genetic variant or not.
In the last month, daily tests have fallen from around 2 million per day to 1.5 million per day. Nuzzo says that could partly be from states that are transitioning staff from testing to vaccine rollout, which is good. She says we need it, but she also says we need to remain diligent despite tens of millions of people having already gotten the vaccine.
We don't yet know if the vaccines will prevent people from becoming infected, and we don't know if they will prevent people from transmitting that infection to others. So it is still important for people to get tested because that'll help us better answer those questions.
I'm Dan Grossman reporting.
The Center